I'm Dr. John Minichetti. I'm one of the co-directors with Dr. Brian Jackson of the 2025 AAID annual meeting, the American Academy of Implant Dentistry. This year meeting is going to be on November 12th through the 15th, 2025. It's going to be in Phoenix, Arizona, one of our first times at a convention center. Yes, we are growing. We are so excited. And we have a star-studded cast of speakers. One of them hopped on a Zoom for a conference interview. Thank you, Dr. Bart Silverman. Welcome.
Thank you, John. Thank you so much. My
So,
pleasure.
Dr. Silverman, as an introduction, I've worked with him over the past 15, 20 years. He is a board certified oral maxillofacial surgeon. He also is board certified with our American Academy Board of Oral Implantology. He is now in charge of the oral examination process. He's the past president of the American Board of Oral Implantology. He is quite versed on publications and implant dentistry, lectures worldwide, and we are so excited to have you at our meeting, Bart.
Thank you, John. Thank you so much. I'm truly honored to be involved with the AID. You know that, and especially to be main podium. It's one of the highlights. Thank you so much.
Super. We have you down for November 15th. You are on a Saturday complications lecture. So your presentation, as I recall, is called Prevention and Management of Dental Implant Complications. Tell us a little bit about what you plan on covering.
Yeah, sure. You know, it's funny because I think overall we're seeing an increase in dental implant complications. And I was thinking about it. I was thinking like, why? And I think because, nowadays we're getting some docs that are going to like a one-day course sponsored by an implant company on a model, and they feel competent enough to go place implants. We're getting doctors that are also going to maybe a 1 or 2 day course overseas, not too much involved with diagnosis, treatment planning, not much in follow-up. And overall, we're getting just more and more doctors placing implants. So with these three categories, the odds are in our favor. We're just going to get more dental implant complications. So I think it's an important topic to cover, and that's what I'll be covering on that Saturday.
Super. That's one of the things about our American Academy of Implant Dentistry. We've always stressed the importance of comprehensive implant dentistry education. We are the founders of the AAID Maxi course, which are 300-hour programs, year-long programs. Although we also run weekend courses, etc., we do really stress the importance of educating yourself through thorough comprehensive education, and we also have our credentialing process in place. Why don't you tell us, you're one of the past presidents of the ABOI, one of the first that I've gotten to interview as one of our speakers. Why don't you tell us a little bit about the ABOI and the diplomat status?
Yeah, I think nowadays, right now, the way it is in implant dentistry is that this credential from the ABOI is the highest credential in implant dentistry that we can bestow upon a person. And what we're doing is that in this process, yes, it's nice to have the credential. It's nice to go out and because of the process and what you've learned and going through the examination to be better to treat your patients. But it's also kind of neat to go through the process. And I found I just learned so much in studying from when I took the exam. I learned a tremendous amount. And especially as a surgeon, I learned the prosthodontist. I used to say, I used to joke about this when I took my oral boards as an oral maxillofacial surgeon. When I took my written, I studied for about a week. When I took my orals, I studied for about a month every single night after work. And when I studied for the ABOI, I studied every waking hour for 3 months to learn all about the prosto that I knew I was going to get examined on. So I think it's an excellent process. And this year, we're going to be changing the exam a little bit. We're going to be adding another section in there. So 2 sections out of the 6 will be case defense, which I think would be really, really good because then it gives the candidates a good chance to showcase their work, and it gives the examiners a good chance to really see what the candidates know. So I think it's exciting. I've been involved with the ABOI for a long, long time. And yeah, we look forward to another great year.
Super. Sounds great. So, speaking of complications too, I know you mentioned iatrogenic complications, but tell us more about like some other complications that could possibly be the cause of implant failure.
Oh, sure, sure. I think it's up to us first as clinicians. What we need to do is that I think we need to we're involved in the total process. So what we need to do is we need to look at the characteristics of the materials that we choose to use. So we have to pick out the bone materials. We have to pick out our membranes. We have to pick out our implants, which will give our patients the highest degree of success. I also think as clinicians, what we need to do is we need to assess the patient's anatomy that they come to us with. We need to see the medications that they're on, and we need to overall assign a degree of surgical success to our patients. And hopefully we pick and choose the proper candidates for a good implant process and get the highest chance for success. Um, yeah, I think that's what's really, really important here.
Absolutely. And then as we see more implants being placed, we see the periodontal issues around implants as we do around teeth. And if doctors aren't aware to intervene as soon as possible, we can run into long-term complications with targeting and bone loss.
Oh,
So I
I
think that's
agree.
going
I
to be
agree.
some of the stuff that you're covering. Great.
Yeah, I agree tremendously, and I also think it's up to us also, John, as clinicians, like, we need to pick and choose the proper procedures that give us the least chance for complications, and we also need to assess before we do these cases, can I handle this with comfortably in my own hands, or do I need maybe to get the help of a colleague for for this particular case?
And that's where the AAID and our specialty status runs in place. You can certainly refer to our colleagues who have more experience with these type of procedures. Well, I know us in the academy, there's a lot of camaraderie, a lot of mentorship, which, from you and other seasoned clinicians. So that's a great thing for our younger dentists. And we are encouraging our younger dentists to come to this meeting because not only do we have, co- you know, intricate or advanced lectures on the main podium. We have a lot of basic stuff that you can be learning at some of our workshops, right? And so, Dr. Barr, I know you've run some workshops in the past, I believe, on PRF and stuff like that. How important is it for doctors to get involved with these workshop or hands-on type of courses?
Oh, John, just like you said, yes, it's great to hear the main podium lectures. I mean, where else can you go and you get to sit in for like a 3-day, 4-day period, and you could hear like the best speakers that are out there, the people who are doing most of the research out there, and it's all included in one price. You don't have to pay extra for that. It's just you just getting so much information. I think the other benefit of the AID, like you said, you could sit down in a workshop and all of a sudden turn to your colleague next to you, get to know a buddy. You can make a buddy for life. And I mean, when I first came into the AID, I was so impressed that I could sit down with John Minichetti and I could just become a friend of John Minichetti and just, develop this great camaraderie. And, people are more apt to share information at the AID meeting. Like you said, I've lectured many places, many around the world, whatever it was, but I've never seen the degree of camaraderie as we see in the AID. It's just great to be able to sit down for a couple days, put your guard down, discuss anything you want on a casual basis, and just develop friendships for life. And yeah, the hands-ons are fantastic. I've done some in PRF and sinus lifts and layered guided surgery. It's just great. It's just great. I would highly recommend any of the younger clinicians, even
Yeah.
older clinicians, to take these.
Yep. Speaking about camaraderie, this year we have at our meeting, as usual, we have a host of social events. We have the welcome event on Wednesday night. We have our expo. Our expo is another social we have. And this year on Friday night, we actually moved the American Board of Oral Implantology's luncheon now to a dinner. I understand that there's been some changes. Maybe you want to share that, Bart, with our participants, the changes in the ABOI dinner now.
Yeah, this is going to be exciting. For the first time, the ABOI is having a dinner meeting now, so it's not going to be an extravagance gala like a wedding. But it's gonna be fantastic where we're gonna have, the current board, we're gonna have all the past presidents, and, it is so exciting. We wanna invite spouses to come also. It's really so exciting to be able to honor the candidates who get this credential. We all have to take 2 steps back and remember what we went through to do that. We have to think about what the sacrifices that they go through to get this credential and the sacrifices on their practice, sacrifices on their families, and to be able to get this and now celebrate with your family, it's just fantastic. We love it. We love when they come across the stage, John. I remember when you were president and we were working together on that, just to be able to put the medal on somebody's shoulders there and just congratulate them in front of everybody. It's just absolutely fantastic. Yeah,
It's
we're
a
gonna have a
great
dinner event
achievement
this year.
and nice to share it with our colleagues and our loved ones. In fact, my wife is coming out for that
Uh-oh,
meeting. My daughter, Dr. Karen, will be receiving her diplomat this year in Phoenix.
this
We're
is
so excited.
fantastic.
So my wife will be there for the event. Her husband, Dr. Matt Fusco, another dentist, will be there. This will be his first AID meeting. This is how our academy is growing. We have young doctors and we have lots of women. They have a women's luncheon on Friday. So we flipped it. That's going to be a great event for women and younger doctors getting involved with the society. So this is a great event. And besides our main podium, our workshops, and our events, we also have our poster clinics. We have our table clinics, and we also have a corporate forum this year which is something new, where we are going to have speakers sponsored by certain corporate entities speaking on their latest technology. So it's going to be a great event overall.
Should be great. Looking forward to it. I can't wait, actually.
Yeah, me neither. I think it's going to be awesome. So it's November 12th through November 15th, 2025. All of our colleagues are going to be there. We're going to get a good turnout from our members, and we're looking for new participants. So please, if you haven't checked out the ID, check out our website, AAID.com. And you can look at our annual meeting. You can see the plethora of education we have this year, including great speakers like Dr. Bart Silverman. Dr. Bart Silverman, any last words for the group out there?
No, no, John, I just can't wait. I'm telling you, it's so exciting. I want to thank you very much for being co-chair. I know it's going to be another fantastic event.
I'm excited to have you. Thank you for participating, and thank everybody who's working so hard to make this meeting number one this year. That's checking out Phoenix, Arizona, November 12th or 15th, AID.